Stay in Gauteng, the provincial government says the number of daily COVID-19 cases are slowly starting to decline, although deaths due to the virus remain high. Despite the silver lining, Gauteng residents have been cautioned that the second wave is not necessarily over yet and that the healthcare system could still face some strain. For more on the situation, let's bring in Dr. Mary Kaunga, who's the leading provincial COVID-19 advisory committee member. She joins us via our video link. Doc, thanks very much for your time. Welcome to the program. So we're saying infections are on a downward trajectory, but the second wave isn't necessarily over. What are we using to make this call?
Good evening, Ayanda, and thank you very much for the opportunity to talk to the listeners through your show. As we presented in the media briefing this afternoon, there were four main indicators we were using to look at the trajectory of the last few weeks. So the first one was new cases. So we've seen a reduction in the number of new cases being reported on a daily basis. And when you look at a week-on-week analysis, a change in terms of week-on-week, we've seen a reduction there as well. Then the other indicators we used were percentage tests positivity, and this is the percentage of tests that turned out positive, and that's, as you correctly said just now, has gone to below 20%, indicating that the risk of transmission has reduced in the community. We've also looked at hospitalization, new hospital admissions due to COVID-19. We've seen a reduction in that number, as well as a reduction in the number of deaths that have been reported. However, what we've noticed is the number of deaths still remains quite high. So for example, in November, before the second surge started, we rarely saw more than 100 deaths per week. And in the last week that ended 23rd of November, we saw more than 700 deaths that week alone. So even though there's been a reduction of about 5% compared to the previous week, we're still concerned that this is not sufficient indication that we're in the clear. And so what we're recommending is that we continue monitoring the deaths and the hospitalizations as well. I mean, we're still seeing more than almost 2,000 new admissions per week in our province. And so the indications are that the numbers are down, they're reducing, but they're not low enough for us to say we're in the clear.
Yeah, and Doc, help us understand why that is. And I'm referring to the deaths now. Initially, we were told the so-called South African variant is more contagious, but isn't necessarily deadly. But now we're seeing a situation where infections are going down, but the deaths are still stubbornly high. Is this suggesting to us, in part, that perhaps our understanding of this variant wasn't accurate?
Well, I mean, I think one has to look a little more closely at the numbers. Yeah. And often the experience we've seen is that once we start seeing a reduction in cases, in new cases, deaths don't go down immediately. So maybe what we're seeing is probably just the normal lag. So for example, new cases started to reduce, not what last week, but the week before, but the deaths were still quite high. It's only this last week that ended the 23rd of January that we first saw a reduction in deaths by 5%, a 5% reduction compared to the previous week. And so we're not suggesting necessarily that, it's because of the variant. It might be, we don't know that yet. It might just be that we're seeing a lag, and that maybe next week, if we see that the tendency for reduction in terms of deaths continues, then that will give us a glimmer of hope. And the other indicator I must say that we looked at was the excess deaths. So the Medical Research Council every week publishes a report looking at excess deaths. And so these are the number of deaths that exceed the predicted number of deaths that would have happened, for example, if we hadn't had the COVID pandemic. And for the first time in several weeks, we've seen a slight reduction in the number of excess deaths. And so that's given us some indication that we're definitely we're probably going to see a reduction in deaths as well. It's just that we're not there yet. And so what we're saying is just be cautious and let's just see and see how the pandemic goes. And when we're in a little bit more of a stable situation, perhaps some decisions can be taken about public health and social measures, whether to ease measures or not. But at this moment, we just felt it was too soon.
All right. And that's really preemptive to what I wanted to ask next. We're getting a sense that we still need to continue navigating this tightrope. But, there's been mounting calls for things like the alcohol ban to be lifted, et cetera, et cetera. Your advice to government, given what you're seeing in Gauteng, is we shouldn't do that just yet.
Yeah, well, I think in the briefing, the Premier did sort of indicate the stance of the Gauteng Provincial Government. And I think they took that stance based on our assessment of the hospitalizations. So because we had such a rapid increase in new hospitalizations in the last few weeks, what we've ended up with is a number of patients are still in hospital, because I'm sure you can imagine COVID-19 cases who are in hospital. They tend to stay in hospital for 5 days or maybe longer. And so week on week, the patients who were, for example, admitted last week, this week, some of them might still be in hospital, and yet we had an additional number of admissions coming in. So the hospitals are still a little bit stretched. And I think one of the things that's allowed the health system to cope in the last few weeks is the fact that there was the ban on alcohol and therefore less trauma cases. And so the hospital capacity that would have been used for trauma cases perhaps has been diverted and used for catering for COVID-19 patients who are admitted in hospitals. So I think it was on the back of that analysis and the advice about the fact that our hospitals are still under some strain and are not yet able to sort of breathe a sigh of relief, despite the fact that we're seeing a reduction in new cases as well as some reduction in new hospitalizations. Yeah. And so it probably would be prudent to keep the alcohol ban. I know the decisions still have to be taken at a political level. All we do is provide the statistics to the decision makers about what's probably a good thing to, which public health and social measures are good to put in place and which ones might be worth easing.
Well, it is very much a sobering stance, excuse the pun. We, of course, now counting down to the first consignment of COVID-19 vaccines arriving in the country. I wonder whether we've gotten to a stage yet where we're able to tell the impact that this will have on the numbers as the jabs are being given. As the COVID-19 Advisory Council in Gauteng, have you wrapped your head around that? Once the jabs arrive, when will we start seeing the impacts they're having on the actual numbers?
Yeah, thanks. That's a really great question. And I think it's absolutely important also because so far what we've heard is the vaccines are going to arrive in batches or tranches and not all at once for 67% of the population. And so we do have to be quite judicious in how we vaccinate and try and ensure that we vaccinate the populations in a phased manner, but in a manner that allows for a maximum impact in terms of health benefits. So optimal use of the supply of vaccines that we have for maximal health benefit. And in the press briefing today, one of my colleagues on the advisory committee, Prof. Bruce Malado, and the team that's on the committee working on modeling have started looking at this. And what they're doing is developing algorithms that can allow us to try and target populations, even more targeted than the criteria we've received thus far from the National Department of Health. And so I think that's something that we'll be working on. And what Prof. Milado presented today was just preliminary work that's been done to try and come up with an algorithm that allows the Department of Health and the Gauteng Provincial Government to target populations such that as we vaccinate slowly, we're probably prioritizing and vaccinating where we think will get maximal benefit in terms of the population to target for the first few, over and above the health workers, obviously.
Absolutely.
So, yeah.
All right, thanks for your insight. Really appreciate it. Important questions that need to be answered, especially as the fatigue continues around COVID-19. Certainly can't let our guard down even now. Dr. Mary Kawonga is leader of the Gauteng COVID-19 Advisory Committee. Doc, thanks very much indeed.